All right, welcome my friends to another episode of Extreme Health Radio. Thanks so much for joining us. Let me turn that music down. We're only 10, 15 minutes late today, which is a record for us. So I appreciate your patience for those of you that are watching live on YouTube. We always seem to have technical issues, so I appreciate your patience a lot. So this is going to be a lot of fun. Today we have a great show. We're going to talk about Alzheimer's disease. We're going to talk about the connection to your eyes and all kinds of really, really interesting things that you probably may have never heard of before. So we're going to introduce our guest in just a minute, Dr. Thomas Lewis. Before that, if you guys want to grab any of the show notes or the actual page episode for today's show, it's going to be, everything will be available at extremehealthradio.com/631. So all you got to remember is 631, and I'll make everything available there to you. So that's where you can grab the show links to the sponsors and all that good stuff. How are you doing today? I hope you're doing great. Hope you're having a great Monday wherever you are listening around the world, in the future, in the present. I hope everything's going great with you. So I was just reading a stat before we started the show that 50 million Americans have Alzheimer's disease. It may even be more than that. I don't know, but some sort of dementia or chronic neurological disease. Alzheimer's, 50 million people. That's crazy. So my goodness. All right, so let me read Dr. Lewis's bio real quick so you can kind of get an idea of who he is and what he does and all that good stuff. He's a leading authority in mechanisms of chronic diseases. He's a Ph.D. from MIT, from Harvard. Pretty cool, huh? His main leader at the Health Revival Partners is the translation of the best bred medical knowledge of mentors and thought leaders into logical disease prevention and reversal protocol. And he's been on a number of different summits and online presentations, which is where we learned about his work through. It might have been the Alzheimer and Dementia Summit. He was a featured speaker on there, as well as the chronic fatigue. It's just crazy to me. We have to have a summit for chronic fatigue. My goodness, right? Crazy, right? And then he was also on the Immune Defense Summit as well. And he's the author also of the book called The End of Alzheimer's, The Brain and Beyond. And what's cool is that he got into this field because of what was going on with his father. And I'm in this field because of my mom's diagnosis in 95 with non-Hodgkin's lymphoma. And isn't it interesting how we get involved in this weird, crazy world of natural health because of family members or maybe our own health. So let me bring Doc up on the screen here. Doc, thanks so much for being here today. I really appreciate this.
Hey, Dr. Really my pleasure. And I think you mentioned my dad and your mother, and I think it's the people that have the testimonies in their life that are really motivated and extra specially driven to find solutions. And I know you have, and that's what I've worked on all my life for the last 15 years since my dad passed from Alzheimer's.
Yeah, it's interesting, isn't it? Some people get involved in natural health because of their own sort of health scare, and I completely get that. But I feel like it's a sort of a different breed of people that get involved because of something they see in their life that's not even related to them, or, but like a family member. So were you involved in this stuff before your dad was diagnosed?
Well, actually, after I graduated from the Harvard School of Public Health, I had some knowledge in toxicology, and being a chemist, I was looking at early indications that aluminum was a part of the pathology of Alzheimer's disease, and looked at that for a number of years. And my dad comes down with the disease, and we were pretty much hopeless to help him. He was just on Aricept and the usual things, and he deteriorated and passed on, like I said, about 15, 16 years ago. And around that time, I was very active at the MIT Enterprise Forum, and I met a very interesting clinician at Harvard, an ophthalmologist of all things, and he was showing me some of this data, and he was literally reversing people that looked just like my dad had several years before he really went down on that slippery Alzheimer's slope into not even knowing my own name.
Oh my goodness. Now, how old was your dad when he was diagnosed?
Well, he was the original organic gardener, and we always had fresh vegetables, and he had a great lifestyle and was active. So really, he was 87, and he really developed it when he was 84 and went down very rapidly thereafter.
My goodness. Do you, looking back, do you now see signs of it prior to the diagnosis that you didn't pick up on at the time?
Justin, it's like we're playing, colorman and whatnot, an announcer here, because you just teed it up for me. Because 10 years before my dad was diagnosed with Alzheimer's, he was diagnosed with glaucoma. And now I know what very few people know, is that glaucoma is Alzheimer's disease of the eye, and Alzheimer's is glaucoma of the brain. Mechanistically, they're exactly the same. The difference is the eye has something that's called ocular immune privilege.
Mm-hmm.
So it tends to be more susceptible and vulnerable to inflammatory conditions. And so it'll actually express in the eye before it expresses in the brain.
Well, that would make a lot of sense, wouldn't it? Because aren't the eyes just an external manifestation of brain tissue?
Yeah, there's no question, Justin, that, John Dowling, a distinguished professor at Harvard, wrote, the retina, which is the back of the eye. His book, which he just updated recently, is called The Retina, the Approachable Part of the Brain. And embryologically, the eye is an extension of the hippocampus. So, but I think more than just it showing up earlier in the eye, is that technologies we have to evaluate and assess the eye, because the eye is relatively transparent, are extremely precise and accurate at measuring tissue. Let me give you an example. OCT is just a tomography. In other words, it measures three-dimensional structures. An MRI, it measures three-dimensional structures too. But because the eye is transparent, what OCT can measure, it measures maybe 10, even 100 times greater detail than an MRI does. So for example, in the back of the eye, we can see capillaries. We can see literally blood flowing through capillaries, with an MRI just sees broad, gross structures at that point. So we can see the earliest genesis of a neurodegenerative process in the back of the eye.
That's so fascinating. If you guys are listening to this and you know of anybody with any kind of eye issues, or perhaps if you know of anybody with some of these neurological diseases, ALS, Alzheimer's disease, these types of things, pass this show on to them, or tag them if you want them to hear this. But that's really interesting to me. So so your dad was diagnosed with glaucoma 10 years before, and how long do you think glaucoma had been sort of settling in with him prior to even that diagnosis?
Probably the exact same amount of time that Alzheimer's had been settling in. I mean, all these diseases are on a continuum. You don't just catch Alzheimer's, catch diabetes, catch cancer. There are usually early warning signs before that. So just sort of segue into that, Justin, we've developed a concept, and it's a concept every functional doctor knows for the most part. It's what I call four-dimension medicine. Determinants of health, environmental factors, genetic factors, things of that nature. Then physiological changes, which we measure in the blood, and if done accurately, can be very telling. But most labs are looked at from an acute perspective, not a chronic perspective. Then this dimension 3 I call pathological changes. And so like you can do tissue biopsies or MRIs, but actually the eye is a much better way to investigate the early antecedents of pathological changes, which, hey, you may have physiological changes, but it may not manifest into pathology because you take care of yourself. But a lot of people have these pathological changes and are not acting on them. Then the last stage, dimension 4, is you actually have diagnosable disease. So, each one of them lives on their own continuum. And what I think my team's particularly good at is measuring where you are on each of these sort of overlapping dimensions, if you will. And I think what functional medicine is not good at is measuring dimension 3, what's going on in terms of pathological changes. So, like a pathological change is disease, but it just hasn't gotten to the point maybe of where it's manifested into an actual clinically relevant and humanistically relevant problem.
Now
that's how we use the eye.
That's really fascinating. And as someone who listens to podcasts all the time, and typically whenever people are listening to podcasts or radio shows like this, they might be doing the dishes and they kind of glance over stuff. So can you quickly revisit those 4 points again in case someone was not listening fully? Because I think that was really kind of the crux of what you're talking about here, right?
I mean, it really is. And that's what Dr. Tremp taught me, that these eye pathologies come from somewhere. They don't come out of the blue. He used to say, like, God doesn't think you're a bad person, so he's punishing you. These things happen for a reason, and that's the mechanism. So dimension 1 are just determinants of health: lifestyle, epigenetics, environmental, social determinants. Those all modifiable risk factors lie in dimension 1, and these are largely responsible for future chronic conditions, reversible, which most of them, if not 99% of them, are reversible.
Uh-huh.
So dimension 2 is looking at your physiology. It can be a stool test, saliva, urine test. We mainly use blood, but the problem with blood tests today is they're not going broad enough to look at inflammatory things. And then even when they do, they're not looking at where you are on the continuum. You're either sick or healthy. So, for example, let me use white blood cell counts, for example.
Mm-hmm.
You know, the range in the standard of care is around 3,800 to 11,000. That's normal.
Okay.
But the Nurses Health Study, a huge study of 67,000 women at Harvard, if you have two groups of women, one has a white blood cell count of 4,700, another group has a white blood cell count of 6,700, and you follow them for 6 years, 50% more of the one at 6,700 die. Okay? So is 6,700 a normal clinical laboratory value for white blood cell count? Yes, from an acute disease perspective, you don't have sepsis. But from a chronic disease perspective, it's completely abnormal. And so we've developed a whole algorithm around where does a marker change and where does that change, physiological change, lead to an increase in early mortality. So we call this barometer that we use, which is an amalgamation of blood labs, your chronic disease temperature.
Interesting.
And so, you know, you have the social determinants, the environmental determinants, the lifestyle determinants, dimension 1, leading to physiological determinants. And the next thing is, if your physiology stays bad, if you will, and doesn't reset to a normal level, you have something chronic going on. And if that stays in that state long enough, you're going to start seeing pathological changes. That would be dimension 3. We see that in the eye. When you see something going on in the eye, it's usually pathology. It's usually tissue changes, which is advanced, closer to disease, then blood changes. And then the last dimension, the fourth dimension, is simply you now have a diagnosis. You feel lousy, you know, you have a diagnosis, you're diabetic, you have psoriasis, you have brain fog, you have dementia, you have something, you know, one of the 68,000 ICD-10 codes that characterizes you as sick. But that's dimension 4. And right now we live in a society that does one-dimensional medicine, dimension 4, and that's it. Either healthy or sick.
Yeah.
And we're really on a continuum in all 4 of these dimensions. And, you know, we need to measure where you are.
That's
and
so
if the more accurately we measure and the more frequently we measure, we can figure out if our interventions are working to reverse you down any of those continuums.
So that is really interesting. So if you guys are listening, we're with Dr. Thomas Lewis, and his website is realhealthclinics.com. And this is episode 631 for those that are joining a little bit late. So really fascinating stuff. And so I know before we sort of started recording, you mentioned you're being bombarded with blue light, so which makes me know that you understand the whole light piece as well. Do you suspect that there's any connection with what Dr. Jack Kruse talks about with blood testing not necessarily being something that you can trust, because anytime they do blood testing, you're doing it under non-native EMF and blue light? Or do you think that he's not really accurate about that? Because it seems like he's taking...
I know quite a bit about Jack. I haven't had the pleasure of talking to him, but you know, he actually presented at an optometry conference two or 3 years ago. I just presented to this year.
Oh, okay.
And, you know, I think it's being a scientist, we never do a single measurement. We do multiple measurements. And when I see, you know, I work with individuals, coaching them. I have doctors on my team. I have coaches on my team. And when we see cause and effect between labs, you know, in dimension 2 and changes in lifestyle, environmental factors in dimension 1, and labs improve and we can show a consistent trend, I'm pretty compelled with multiple measurements that the numbers we're seeing are real. I mean, there's a lot of things that will skew numbers. You know, take white blood cell counts, one of the most impactful but difficult to interpret labs. So, for example, viruses will lower your white blood cell count. Bacteria will raise your white blood cell count. Many people who are sick are comorbid with both. So, you know, there's a lot of art to reading labs, but I think the key thing is to measure at a reasonable enough interval that acute factors aren't interfering with chronic factors. And let's say light in EMF are interfering, Well, I think that's a real risk factor. If your white blood cell counts are up, your neutrophils are up, your fibrinogen is up, your SED rate's up, homocysteine's up, something's brewing. You're not heading down a path towards being healthy in the future, and there's something we should do about it. And if the interventions lower these numbers, then I believe it's real. And I believe the outcome is improved health if these numbers are coming down. And that's the whole thesis of our program.
Yeah, it's fascinating because what you're talking about is building, one upon the other, and also blood testing is just a snapshot in time, but it is a snapshot, though, right? But it's like a picture being taken, and it's the physiological sort of state of someone at that time the test was being taken, but it's not the end all be all, is it?
No, it's not. I mean, we'll do fasting blood labs. I mean, everybody out there is doing, glucose and A1C. The disease is insulin resistance. You have to do the fasting insulin.
Mm-hmm.
That tells you how insulin resistant you are. You've got to do tests with a fair amount of frequency. I recommend roughly every quarter, so that we can get enough data points in a year. Fixing chronic diseases is not a sprint. You go to your doctor for a sprint. You get something nagging right now that you want to solve, and they'll handle that. But chronic disease is a marathon. My rule of thumb is if it took you 10 years to get into a chronic disease state, it takes you 10 months to get out. So we need to measure and track these things, because let's face it, C-reactive proteins are a pretty good test, okay, for inflammation. However, it's also an acute phase reactant with a half-life of 7 days. So if you bang yourself bad and you have an inflammatory response, or you cut yourself and you get a little short-term infection, your C-reactive protein will go up,
Mm-hmm.
and then it slowly comes down over a 7-day period, to half, and then half again and half again. So if we catch you somewhere up here, it may look like you have a chronic response to C-reactive protein, where in fact it really isn't. That's why we would measure. I wouldn't do a test in 2 weeks. I'd do it in 2 months, 4 months, something like that, and then chart it out. We do a lot of charting. I'm a scientist, and I was just charting white blood cell counts on a participant with Rocky Mountain spotted fever today, and he's had chronic fatigue. You mentioned chronic fatigue at the beginning, Justin. In chronic fatigue, there's many factors, and one of them's intracellular infection, which we find in a lot of patients with severe eye diseases that get inside the tissue and literally act like mitochondria and rob the energy you're trying to supply your cells of that energy. So you become fatigued, or you become diseased, or both. But yeah, I think you can overcome the shortcomings of labs by grabbing data points and doing trend analysis. That's all. My dad taught me when I was trying to learn a little geometry, 1 point in space is nothing, 2 points determine a line, but 3 points determine a plane. And now we have a better picture of what the object is, if you will.
Yeah, that makes sense. That's cool. Yeah, that's a good way of looking at it. You mentioned at the beginning about, the 4 phases, and I thought that was really interesting. And so at the beginning phase, you talked about risk determinants, lifestyle factor, stuff like that. And I would imagine genes are in there, and I'm curious what your thoughts are about, genes and determinism, and this idea that we, if a woman has the BRCA1 gene, she, it runs in her family, she's going to have breast cancer. And, there's women out there that are getting preemptive breast removals, and so what are your thoughts about genes being a deterministic factor like that?
Well, I think most of these diseases are not of the chromosome, so in other words, you don't have sickle cell anemia, you don't have Down syndrome. So all these are modifiable, but there's no question. I wrote a paper with Dr. Tremp called, it was published in Frontiers of Neuroscience Aging. It was how you prevent or eliminate the epidemic of Alzheimer's from pre-birth to death. So there's no question that people can start off life on a bad footing. And the genomics and epigenetics can articulate that. But what we found in our practice, because the eye is so uniquely interesting in terms of a diagnostic modality for disease, you literally can see disease in the eye. Okay, you can see the vessel, you can see the microvessels, you can see aneurysms, you can see amyloid plaque formations, okay? And then you can correlate to the blood labs. And then you do treatment for 3 months and you see where that person has gone. Has the aneurysms gone away? Has other things improved? Have their overall health status improved? So, for example, in macular disease and in Alzheimer's, the APOE4 allele has been highly notorious in these conditions. But what we found is that when you do genetic testing and you have two people with, I'll just pick macular degeneration as an example.
Okay.
One has the double 4 allele, so they seem to be really in a bad state. And another person has the double 2 allele, so they're supposed to be much more resilient to these diseases, but they both have the condition. When you investigate further to find underlying factors like inflammation, sensitivities, infections, things like that, and you treat them properly, they both get better.
Interesting.
So my biggest complaint about the genomics is, does it tell you what to do next? And does it provide the individual with a crutch of hopelessness, that there aren't other things they can be doing or solutions to their problem? So I've actually shied away from genomic testing and really are just relying on the physiological, pathological, and determinants of health and working down those scales to improve people's resilience. I have this little concept. I have the 4 dimensions of health, but I also have the vessel concept, It's like, how full is your vessel? Are you inclined to be sick? Are you inflammatory? Are you genomically inclined? But health isn't about one thing. It's about a lot of little things. So let's improve upon the little things and empty out that vessel of risk as much as you can. And I think that's a message of hope rather than despair, where, oh, that's my fate, so I've got to remove my breasts or whatever else. No.
Yeah.
I think there are other ways you can modulate your future risk.
Yeah, I like what you said there, because that's so true, isn't it? When someone says, they're come down with a diagnosis, or maybe they think they have something, and they have a gene for it, and it's almost as if like we have this idea. Maybe it's we've been trained by the medical industry for too long, but they just have this idea that I've got this gene, so I'm a ticking time bomb until this gene sort of expresses itself. And like you said, that just completely removes, the power that anybody has over their environment and their phenotypic expression and all that,
One of the most important studies in this space are the twin studies, that there's no one closer genetically than twins. And when you study prospectively twins, and there are many, 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 many studies out there where twins separated at birth have extraordinarily different health portfolios, as different as their environment once they left mom. I mean, once again, I think there are things that get passed on. Type 1 diabetes, that is not a genetic disorder. That's a virus in so many cases. That's an infection. I just diagnosed an 80-year-old with type 1 diabetes. I don't diagnose, I'm just a chemist. A medical scientist, self-trained with lots of doctors. But when I see someone with slightly elevated glucose and slightly elevated A1C, that's not the whole story. What was her fasting insulin? And at 80 years old, it was clear that her pancreas was dying. I did the C-peptide test too. And I did an infectious test, and she has mycoplasma and other infectious species that I believe are destroying her pancreas.
Wow.
So is this at 80? A manifest genetic disorder at 80?
That's weird, right?
Really?
Yeah.
Or is it something environmental? One of the mentors I haven't had a chance to talk to him because he died in like 1880 or thereabouts. Claude Bernard.
Okay.
What he said, he was the father of modern experimental medicine at the same time as Louis Pasteur. And he said, the experimenter who doesn't know what he's looking for won't understand what he finds. And so the genomics is a convenient way to put things into a box when we don't understand things well. I think, it contributes, but it's not the whole story. That's all I have to say. So we don't do genomic testing. If someone wants to work with me and do genomic testing, yes, I have people that'll do genomic testing on them. And, I listened to Jeffrey Bland about all the genomics, and he said, well, I ran my genomic test and I found out something about my vitamin D. Well, what did he do? He measured his vitamin D. And then what did he do? It was low. He took vitamin D. I can skip one step
Yeah,
and save
yeah.
you some money.
That's so interesting. So I'm curious about what you said before about the OCT. Is that what it's called? The OCT test for the eye?
Yes. Optical coherence tomography, and it's just like MRI. And see what these are waves of light that interfere with tissue and create this three-dimensional mapping.
Okay.
So MRI uses light like this,
Uh-huh.
and it can only discern structures as big as the wavelength, whereas OCT uses light like this. So it's able to measure and create images, three-dimensional images of much, much smaller structures. So
That's
we
interesting.
can see capillaries, but I think the most profound thing is the retinal nerve fiber layer, which is visible via OCT, and it's not an expensive test. It's non-invasive,
Really?
not painful, and it will measure you and remember where you are so we can track progression or regression. But like, I have teenagers that have what we call fallen off the wagon. They're functionally fine, and all of a sudden they go into this depression, removal from society. And when you run an OCT on these people, very often you see severe neuroinflammation or atrophy on this retinal nerve fiber layer. And very often they have something like Lyme disease
Wow.
as, as the root cause of what's going on. So, if you have chronic Lyme disease, and if it's affecting your tissue in a neurological way,
Mm-hmm.
very often it will show up in an OCT, and long before you go into a depressive state or ADHD or any of these other neurological conditions, which may have, not always, but may have an infectious antecedent. You look at something like toxoplasmosis.
Mm-hmm.
A good eye doctor can see a toxo scar in the eye, very clear. This is a parasite that can get in the brain, and the number one thing associated with toxoplasmosis is schizophrenia. But
Oh.
dementia, mood disorders, antisocial behavior, intermittent explosive disorders. But the OCT will very often show that condition that can't be seen in a brain scan because the brain's resilient. And you don't even see things in the brain in dementia, for example, by MRI until someone has at least 15% atrophy.
Oh, really?
It's a long, slow process.
Isn't that crazy? That stat I was reading before, dementia and Alzheimer's, I think it's like 50 million people are currently dealing with that. I'm not sure if that was in the US or worldwide,
That's
but
global.
man,
That's
it's crazy.
global. In the U.S., it's around 5 million,
Wow.
but the orb of people affected is much higher. And you never know. This lady who hired me, that I just determined she had type 1 diabetes,
Uh-huh.
she had brain fog, and she was
Wow.
going to a neurologist to be diagnosed for dementia and put on Aricept. I mean, she has an energy crisis in her brain because her pancreas is failing to provide insulin.
Wow.
So I'm sure there are a lot of underdiagnosed people with dementia, and I'm sure there are
Uh-huh.
a lot of overdiagnosed as well.
What do you think?
And
How a lot of people will say that, a lot of these diseases are modern diseases. You don't see people like in the time of Weston Price, the native Africans or people that are living close to the land and things coming down with these sort of modern diseases. Do you think that that stage one of the way of looking at health is at play here, where maybe a lot of these diseases are just the way we're living and the environment we're in?
right, so I have two websites because people get confused about. I will answer the question, Justin, but people get confused about, are you talking about chronic disease generally, or you're talking eye or brain specifically? So I have one for each. But on my Health Revival Partners.com website, under About, one of the gentlemen I list there, and I've had several conversations with him, he's an advisor and a mentor, is Paul Clayton. And he and this librarian from England, he's at Oxford, wrote a series of 4 articles on the mid-Victorians. They lived in 1870 Britain, and they were unusually healthy. And in fact, those people, when you exclude 0 to 5 mortality,
Uh-huh.
okay, these people lived as long in 1870 as Brits do today.
Really?
Okay, and they had 1/10 their chronic disease, and he attributed it all towards the fact that these people ate a very healthy diet. When they ate the chicken, they ate the whole chicken. There's
Yeah.
Paul Clayton right there. So, oh no,
There we go.
that's
Yeah.
Charles Mayo. This is Paul Clayton. So
Yeah.
you can look it up. It's available for free on the internet. It's
Interesting.
called How the Mid-Victorians Lived, Ate, and Died. Okay.
Wow.
And so he was one of the original people to really put together the relationship between nutrition and good health and longevity and reduced morbidity. So what he claimed in 1870 England, the average age of anybody who lived past 5 when they had all the infectious disease mortality in children is that they both lived to around 80, and the mid-Victorians had 1/10 the degenerative diseases. 1/10. Imagine if our society had 1/10. That means right now 60% of Americans have at least one chronic condition. That means that 6% of Americans would have one chronic condition at most.
Isn't that crazy?
And that's what we believe the bar is for chronic disease. Not a 20% reduction, not a 50% reduction. I'm talking about a 900% reduction if you can compare to what the mid-Victorians experienced when they survived that early childhood mortality.
Man, this is so fascinating. Yeah, if you guys are watching in the chat room and you want to have a question for Dr. Lewis, and we have our Skype hooked up, so there's a possibility that you could call us on Skype at Extreme Health Radio is our little tag there. So if you want to do that after the break, and then if you want to type in your chat room or your questions on chat after the break as well, that would be really, really cool. So if you want to do that, just make sure to type them in all caps, and we'll take some of your questions after the break. And also what I'm curious about too, and maybe Dr. Thomas can think about this during the break, is where this chronic disease is starting. So for example, does it start in the eye and then it goes to the brain, or is it starting in the body in the brain and then it shows up in the eye? So we'll get back to that after this break. So really fascinating stuff. If you have any questions or anything like that, make sure to type them in all caps. And I wanted to share with you some of these tools that we have in our home, and these are such great pieces of equipment. I'm such fans of these things, and these are sauna therapy devices. And let me bring one of these up so you guys can take a look at it on our website. And if you guys want to support the show, all of our products that we talk about are available at biocharge.me. And here are some of the sauna products. And let me share with you what Dr. Thomas Levy had to say about sauna therapy. I think you guys were just talking about sweating, right? And detoxification. So that's going to be huge for people.
No, it's as long as you make sure you get plenty of the good minerals, man, having a regular sweat in a far infrared sauna is one of your best health practices you can come up with.
Yeah,
because you get rid of a wide array of toxins. I mean, you get rid of mercury, you get rid of iron. They would have you believe you can't get rid of iron, but a lot of the older clinicians called the skin the third kidney.
Yeah, that was Dr. Thomas Levy, and here's Dr. Robert Young talking about sweating as well.
You mentioned the sauna. The reason why we go into the sauna is to induce a fever. Because when we induce a fever, our pores open to remove these acidic toxins. The reason why we jump on a rebounder is to activate the lymphatic system to remove acids out through the pores of the skin, which is the largest elimination organ of the body. So we do this on a daily basis. And this is when you enjoy the greatest level of health and vitality. Take your money and invest in yourself and educate yourself and take care of your bodies. Go buy a rebounder, go buy a infrared sauna, go buy organically non-GMO'd food. That's your healthcare plan.
I love that. It's so true, though, invest in yourself. And that's one of the things we like to do. And if you guys are interested in some of these saunas, the one that we use and recommend is called the Relax Far Infrared Sauna, which is sort of a personal unit. What I like about it is that it heats up right away. I mean, there's no preheating this thing. And what's cool is that it's very, very low EMF. And the best part about it, in my opinion, is that not only do you start sweating right away and some of these fat-soluble toxins and chemicals that we're exposed to, 60,000 new chemicals introduced into our environment since the early 1960s. And that's new chemicals, not counting the 84,000 chemicals that are in commerce as we speak, and not counting the chemtrails and the tire dust and the what Stephanie Seneff talks about, the glyphosate being in the air that we're breathing. I mean, this stuff is getting into us. So what's cool about it is that it sets up immediately, and you get in there and you sweat. I start usually sweating in about 10 minutes or less. It's just an awesome thing, and you can lend it to a friend. We just sold one today and to a listener, and we ship these things all throughout the world. But if you guys are interested in the near infrared, we have those on biocharge.me as well. The Sauna Space, the Illuminati one, is really cool. And we also have an ozone sauna that you can get from Promo Life through biocharge.me, as well as the bigger sort of clear light ones that are the wooden ones. So if you're in the market for a sauna and you really want to make this a part of your home, really look at supporting us and buying one of these saunas from our store, biocharge.me. And also wanted to share with you this really cool clip by Stephanie Seneff, and she talked about red light therapy. Now, this is a healing modality that I've been doing for some time, and check out what she has to say about it.
Your commercial was interesting to me because it turns out that infrared light is a very special light that grows the exclusion zone. I don't know if you've talked to Gerald Pollack. Have you ever interacted with Gerald Pollack?
Yeah, he's been on the show. He's great.
Yeah, because he's the one that I learned this from one of his papers, that when you expose the body to infrared light, and they found that the exclusion zone water, which is that special structured water that's created by the sulfates in the blood, that grew by a factor of 4 in the response to the red light, the infrared light, which is going to be in the red light. They're going to have some infrared there. And one of the key benefits of the red light might be increasing that exclusion zone, which is going to actually increase the strength of the battery, which is going to supply more energy to the cells, because that exclusion zone is the basis of the battery, I believe, that supplies electricity to the body.
Yeah, it helps the mitochondria create ATP, and it just
exactly.
shrinks the respiratory proteins. I mean, light therapy is huge. Light therapy is a big deal, guys, and it's one of the things I use on a daily basis. And what's cool about these Joovv red lights is that they're sort of modular. So what you can do is you can set them up and you can sort of grow with it in time. And like if you're watching on YouTube right now, you see this girl and she's sort of surrounded by all this red light. I tell you what, our neighbors probably think we are just absolutely nuts because all the lights in our house are red in the evening. They probably think we're doing something crazy. But, this is the healing sort of frequency of light, and it will not, what's the best word? Replace the sun, because from the sun you're getting biophotons. But this red light therapy, though, is a really great machine, the Joovv. Like I said, it's modular, so you can grow with it in time, and you can build full panels that go 360 degrees around you, which is really cool. And it's really great for wrinkles, for stretch marks, for scars, for rosacea skin issues. It helps to build collagen and improve hair growth. It's really anti-aging. It's great for amputations and burns, and you can even preload light therapy too. If you're going to go out in the sun, in the summertime and things. But it's really great for the wintertime. And you can search photobiomodulation on PubMed and read thousands of studies they've done on this. Sometimes they call it LLLT, which is low-level light therapy. But I really encourage you guys to, what was his name? Who was just on? I forget. He was just talking about, investing in your health, investing in your home and stuff, and bring these tools into your home and make your home like a healing center. And you can do these little therapies, 3-4 times a week or whatever your schedule allows. So if you're interested in the Joovv red light therapy, you can go to biocharge.me, and if you're watching on YouTube, you can go down below, and there's links for both of these products as well. And we're going to come back or take a little break. When we come back, if you guys have any questions in the chat room, we'll ask those. Make sure to type them in all caps, and that way I can make sure to see them. And we'll be right back right after this break.
You're listening to Extreme Health Radio, and I hope you're enjoying this show. Please share it with your friends by tagging @Extreme Health Radio on Instagram. Stay tuned for new shows weekly.
I love the country music. That's cool. Yeah, we do a lot of cool things on Instagram. So if you guys want to check us out on there, we share a lot with our little stories and our twin boys and the things that we do to try to stay healthy. So lots of cool stuff happening, as well as updates on our shows and stuff like that. So let me bring the good Doc back up here. And so Doc, before we get into some of those questions, from the chat room, I'm curious about what I was mentioning before, and that is, which direction is the disease process starting? Is it starting in the brain, manifesting in the eye, or vice versa, do you think?
Justin, I sent you a link. Maybe you didn't get it, but anybody can go on to a search engine and type in cataract, Ebola, New York Times.
Okay.
And it'll bring up a page, and it will show, a New York Times well blog, and the very front is a picture of a 6-year-old child, obviously not doing well, lying on her side with a very visible cataract.
Oh, no.
Okay. The cataract is an immune response in our body called a unfolded or misfolded protein response to the fact that she was infected with Ebola. So cataracts, little known, the #1 surgery in the world, is actually a barometer for infection in your body. Now, in her case, she had an acute infection, and there's a huge amount of cataract surgeries going on. You can see right in the middle of her eye there that opacity. That's a nuclear cataract. Why did that form? And if you read the caption, as young as 5, doctors were surprised. Well, we're not surprised, because even if you're 100 and you're developing a cataract, it's a sign of low grade infection and inflammation leading to your body's innate immune response. And one of the components of the innate immune response is the formation of what are called antimicrobial peptides.
Okay.
Now, we have in Alzheimer's, the pharmaceutical industry has mistaken the so-called amyloid plaques as a deleterious thing, not part of the innate immune response. So we can see these amyloid formations in many compartments in the eye, in the back of the eye. Even early macular disease is an amyloid formation. It's been shown to be the same amyloid in the brain of Alzheimer's sufferers, but it's really not an indication of the progression of the disease. It's an indication of your body fighting something, okay? And then the key question is what? So Ebola is obviously an acute infection. So I think this image answers your question.
Mm-hmm.
The infection came first. The innate immune response came second.
Mm-hmm.
Now, the $64,000 question is, where will that manifest as disease later in life? So the thing is, Charles Mayo, founder of the Mayo Clinic, talked about focal infection mainly tied to dental infection. Okay, so you have bleeding gums, it's a problem, but you don't feel bad. Your bones rotting away, you might lose your teeth, but your white blood cell counts aren't that high, they're a little elevated, whatnot. What if that exact same process was going on in your eye, or your brain, or your joint, or your pancreas, or your breast, or something like that? That's what we call a chronic state of health that doesn't just slam you. You're not just all of a sudden sick. You're getting sick on this continuum. So the eye is, just to tell you, it's not a perfect precursor portending brain diseases or even cardiovascular disease, but it certainly we actually see where you are in that continuum. So for example, macular disease, it's called a dry form and a wet form. When it's a wet form, we are actually seeing a vulnerable plaque in real life, real time. Wouldn't a cardiologist love to see a vulnerable plaque in your heart? So I believe, to answer your question, is that in the case of Ebola, very virulent infection. If you and I were exposed to it, we'd get sick too, not just some child in the third world. But there are a lot of things that we call non-communicable infectious conditions, chlamydia pneumoniae, Lyme disease. I talked about toxoplasmosis earlier, Rocky Mountain spotted fever. A lot of infections, but they're not just bacteria. There are viral infections, there are parasites, there are fungi, molds, things of that nature that we're exposed to. And when we're down, when we're fighting a battle over here, they can sneak in from over there, and we're now a vulnerable host, and they may take hold. And they may not manifest like the flu, but they can get in tissue and slowly start creating an entrenchment, dig their foxhole and burrow in and look for future times when you're more vulnerable. And that's where the 4-dimension thing, Justin, is not about anything fancy. It's like lifestyle and risks. That tells you if and when you're vulnerable. The blood pathology can give us clues. That can go up and down, but if it stays up and chronically up, then you got something going on.
Mm-hmm.
And we're just trying to get out of a reactive mode where we wait for someone to have the breast cancer or have the heart attack or start having memory loss before we start working with them. And so the eye really will very often occur before some of these other more severe tissue-related manifestations occur. And that's the time to take action, if not before, obviously.
Yeah. Yeah, definitely. Yeah. Well, Doc, do you want to take a handful of questions, kind of jump around a little bit in the chat room?
I mean, fire away, baby.
Okay, cool. Let's see what we got here. Let me put this on this screen so I can take a look at the chat room. Let's take a look. All right, so we got a lot of people here. This is great. And you guys are from all over. Look, back from Ohio. My goodness, Germany, Mississippi. This is really cool. Florida. Wow. Cool. All right, so I'm gonna go down, and if you guys are listening, I'm gonna kind of go start from the beginning and start with all the ones that you typed in all caps. So the first one is from Ravenator, I like that name. How can you get rid of eye floaters?
Yeah, eye floaters are not really, say, a chronic thing, but but the problem with the lens is that's where they form. The lens is the most interesting tissue in the body because everywhere else you need to have a capillary within 3 cell diameters. Well, actually the lens is one giant cell and it's relatively avascular compared to everything else. So things don't transport in and out of the lens. It's kind of like putty or a very viscous syrup. It's hard for things to move in there. So, anti-inflammatory. I mean, cataracts will dissolve. I mean, I have to remember what Dr. Carter told me, but L-carnitine, I think, is something that'll reduce that. But just really assess yourself for an inflammatory burden.
Mm-hmm.
And, every tissue will repair and recover over time as long as you're not continuing the insult, which will hold things in place.
Mm-hmm.
But in terms of floaters, there's no quick fix for that because you're in tissue that just doesn't have a lot of transport to bring things in and out of it.
Yeah, that makes sense.
These are larger aggregations of tissue.
Yeah, that makes total sense. All right.
Yeah.
Tina says, I am glaucoma suspect. So maybe I think Tina might think that she has glaucoma. Any advice for her?
Well, glaucoma suspect, I mean, in ophthalmology and optometry, glaucoma is a disease of pressure in the eye, so they can measure pressure, and that's an important measurement. But it's really a disease of inflammation and infection and the lifestyle factors that can contribute to that. Now, I don't want to imply, Tina, that you have a bad lifestyle. I don't know what your lifestyle is, but there are opportunities, just like periodontal disease. Healthy people get periodontal disease.
Mm-hmm.
You can have a similar inflammatory condition in the retina that can contribute to this. So, find someone who knows how to interpret labs and figure out the antecedents to disease. I like to think we're very good at that.
Mm-hmm.
We're functionally oriented, looking at things from a holistic perspective. But the number one thing to look at is go to an ophthalmologist or an optometrist and get an OCT. There are 38,000 optometrists, probably 10,000 have an OCT, and they can run that as part of a complete eye exam. And they need to look at the different quadrants of your retinal nerve fiber layer to see if there is any atrophy. And what's cool about these instruments is they're all age graded. So in other words, at my age, my tender age, they wouldn't compare me to a 20-year-old's eye test. So it's really all compared to your peer group, so you can see where you stand in that perspective. But
that's cool.
An OCT, and then run some labs, and we run on our program very inexpensively. I run a very extensive risk portfolio that you can do online, which involves a 1-hour consult to see if I'm finding things that might be contributing to the development of these kinds of conditions, these kinds of inflammatory conditions.
That's really cool. And so has there been anyone that has sort of on a percentage basis mapped out correlations from things like myopia, macular degeneration, glaucoma, things like this, cataracts, and and certain diseases like Alzheimer's? Like, is there a certain percentage with each one, or do we not even know that yet?
I mean, it's extremely well published. The Harvard group published that a cortical cataract or a supranuclear cataract has the same amyloid type as is found in the brain, and this was all done on autopsies. So a supranuclear cataract portends future Alzheimer's disease if you don't take steps to correct it.
Interesting.
A nuclear cataract is highly correlated to early mortality in 18 global studies, starting in America with the age-related eye disease study called ARIDS, which showed that if I take two groups of people, one with an early diagnosis of breast cancer and one with an early diagnosis of cataract, and follow them 6 years, there's similar high mortality. And 6 years is about, an increase by about 10% in mortality in that group compared to people that don't have those pathologies. So a cataract is as deadly as breast cancer, but no one's doing cataract walks because no one knows about it.
Yeah.
This is a response of the innate immune system against infection. And if you're not winning that battle, your mortality goes up. And most people with cataracts will have slightly elevated white blood cell counts, indicating the infection is present. But you're not septic. Like I said earlier, a healthy person has a white blood cell count around 4,700. Someone with cataract might be at 6,000, 7,000, 8,000, which your doctor today would consider normal. It's not normal.
Yeah, it's fascinating. It's really fascinating with this, thing. I'm seeing kids younger and younger, needing to wear glasses and things. And, when I was a kid, I think there was like one kid in my school that had glasses. And now, it's a common thing for kids to be wearing glasses. And I'm just seeing kids younger and younger have eye issues. And I'm kind of worried about all of this screen time. And like Dr. Cruz maps that to your brain and nervous system. Yep. And it's kind of nuts.
I mean, there's no question about the screen time. Most of the myopia, needing the reading glasses, is that these kids are locked here, and we're designed to be locked. I'm pointing outside to the backyard out here, and we're designed to be outside. So when we look long distance, infinity is infinity. Infinity is 4 feet. This is how your eye, your lens adapts its shape to manage vision. So if your infinity is 4 feet, anything beyond that you can't see, and then you lose vision close up as well because you have a very narrow range of vision. But there's a lot of studies now that's showing the blue light, and I should be wearing my blue blockers to set the right example. But there's no question that these backlit blue screens is more intensive in the very high energy spectrum. And there's a group in Spain working with Harvard that's showing that there's a very clear correlation between blue backlit screen exposure and earlier onset of macular degeneration, where you're really hurting the retina and the fovea, the macula, where the light is coming in and focused. We all as kids got a magnifying glass out and concentrated the sun to start a fire, right? That's happening. You're smoldering the back of your eye with these blue lit, these high backlit, high intensity screens. And the important thing is the radiation goes down as the square of the distance. So if you back up a bit, you've actually reduced if you go back 2 feet, you've reduced the intensity by a factor of 4 if you're 2 feet away to start with. So you can limit the dose, and the dose makes the poison for everything.
Yeah, it's the old inverse square law, right? Like you just mentioned.
Inverse square law, absolutely.
Yeah, distance is everything. All right, let's see. Let me go on over to the chat room here. Big Fat Mama, who's a regular listener. I love when she chimes in. She's really cool. She says, what kind of diet and supplements does he and your father eat personally, and over what kind of schedule throughout the day? Good question. What do you eat?
So, we're on a modestly low carb, but I don't like calling anything a diet. What we are on is a high nutrient density food program. So I look at whole foods, nothing has a label. I personally I've been the same weight since 1977. Okay, my wife hates it when I say that, but I've been the same weight. And I've gone through famine and I've gorged myself and nothing changes my weight. I'm in balance, right? So I eat a lot of nutrients. high nutrient density. I eat a lot of fat. And when everybody else was trimming the fat off their meat, we used to be heavy meat eaters, now less so. I would always eat the fat.
Nice.
And I think the best diet is high in fish and high in vegetables. And the vegetables need to be on the low glycemic, end, and that's it. And obviously there's no such thing as an essential carbohydrate. I mean, I do my carbohydrates. I mean, plants are carbohydrate, and what makes plants so special is they're loaded with nutrients, essential nutrients that we can't get other than by eating a food, and vitamins. So you have to get that. But if I was to supplement, and I supplement rarely, mainly because I'm a space cadet scientist, but I just don't create a regimen and I feel great. But cod liver oil is the number one thing I would do for the eye. And if you look at what Dr. Summer does under the Gates grant, is he's bringing a little teeny bit of vitamin A to third world children, and he's sparing them from going blind, because the world is vitamin A deficient, and cod liver oil, better than fish oil, has the natural forms, plural S, forms of vitamin A. So it's very robust in terms of eye health protection. The omega-3s are extremely important to the different photoreceptors in the back of the eye, and omega-3s are obviously part of the whole membrane of neurons, and all the electrical transmission goes across the membrane, so you need a good omega-3 versus all omega-6s, which basically I say short circuits your brain. So most of the things I see in deficiency is a lack of magnesium, a lack of vitamin D, and a good omega-3, omega-6 balance. So cod liver oil, vitamin D, magnesium, K2 if you're not eating a high-fat diet to keep the calcium out of your vessels. Those are the main things that we supplement with.
Yeah, it's interesting. We had are you familiar with the work of Dr. Garrett Smith at all?
I don't know that name. I've heard of most of them, but I don't know him.
Yeah, it's funny. There's so many people out there that are, doing such good research and things. And, but it's so funny because, a lot of our listeners get sort of not upset with us, but they're trying to figure out, got one expert on saying this and another expert saying that. And Dr. Smith was doing a whole show. He did one with us with vitamin A and how he doesn't think it's a vitamin. And he's talking about this detoxification program of vitamin A. And then I was looking at the foods that I eat. I don't really eat lots of carrots or anything, but, he's talking about foods high in vitamin A. And he was talking about some successes he's had getting vitamin A out of people's diets. And prior to that, this was the first time I had ever heard of that. It's just interesting.
It's really interesting. One group publishes this, another group publishes that. All I know is that with cod liver oil, if you take too much of it, you can have vitamin A toxicity. But vitamin A is also a natural antibiotic. And if you look at the history of cod liver oil going back to the Viking era, I have a video on this. I'm not a popular YouTube person, but I do have content for my people that I work with. But, in 1700s and 1800s, when things like tuberculosis were rampant, and, you had 50% of the children didn't make it out of the age of 6, and you had epidemics and pandemics of these infectious diseases. People who this was done in British hospitals, that they had consumption, and that's spitting blood tuberculosis. And there was 6% survivorship if you came into the hospital with spitting blood. If you took high dose cod liver oil, even in its rancid state as it was back then, with all kinds of vitamin A, your survivorship went up 300%.
Wow.
And if you're coughing blood and tuberculosis today, I don't know what your survival is, but it's not good.
Right.
So, there's a lot of studies in what I call the skunk works and labs. But, my medical mentor is like Dr. McCulley at Harvard. He's 85 years old, the founder of the homocysteine theory, pathologist. Wow. He's been at it for 50, 60 years. Dr. Tremp was a practicing clinician for 45 years, using the eye as a barometer for how well his interventions were working. He was treating people systemically not with eye treatments, but with systemic treatments for glaucoma and macular disease in the 1990s. And people were coming back and saying, hey, my husband's memory seems to be getting better, and my wife's memory seems to be getting better. She seemed to be getting better, not just in their eye, but multifactorially. We're treating infection. We're improving the immune system. We're giving cod liver oil. He was big on cod liver oil. And then you mentioned Stephanie Senoff, who I know pretty well. I'm supposed to be writing a book with her, but I can't get my act together to get the manuscript.
I heard about
molasses.
that.
Molasses, it contains a lot of sulfur.
Uh-huh.
We're all sulfur deficient. So, yes, the dose makes the poison on everything.
Mm.
But vitamin A in cod liver oil has a 1,000-year history of improving the well-being of the chronically ill. So I just can't step away from that with one or two people having a study contrary. I need to know their conditions, their cohort, how they selected people, how they tried to isolate the vitamin A from other things. There's so many confounding things that can go into drawing a conclusion.
Yeah.
So I personally take 15 grams of cod liver oil probably twice a week. I put it in a shot glass. I shoot it. I follow it with a little grapefruit juice or lemon water, and that's it.
There it goes, right?
And I swear by it, and
that's cool.
All my inflammatory markers, my insulin, all those things seem to be pretty good. And, I don't run out of energy any day, anytime.
Yeah, that's awesome. That's awesome. Hey, I wanted to ask you, for those that are listening that are relatively healthy and doing well in their life, you mentioned this OCT test that people can get for their eyes, and how it's much more, I guess, sophisticated than, blood testing that's lower down, the spectrum there. And I'm curious, how often should people get that test if they don't have any eye issues and just to want to keep up with their health, do you think?
Yeah, that's a challenge, because a lot of doctors will say, why are you running the test? Because they're all worried about reimbursement and scheduling. But I have on my Health Revival Partners website, you can order an eye test, and I will send you a link or to a doctor that will likely do the OCT for you. So if you went under services, would be the place to go. And then if you go and do that, I'll interpret it. My team will interpret it for you. So window to health, right? And what I include there is a comprehensive risk assessment.
Okay.
And so we'll have a 1-hour consult to go over your entire risk portfolio. If you have any blood labs, I'll look at them from my chronic disease perspective and include that as well. But you go to your eye doctor, get an OCT, and then we'll interpret that result. I mean, all I can tell you is that, I'll give you an example. I was working with a young lady from Switzerland who, she was, I think, 37. When she was 16, she was the national champion of rhythmic gymnastics. She took a little biocidin.
Wow.
And felt pressure. She's 37 years old, cute as a pixie, apparently healthy, doing all the right things, but she felt pressure in her eye. I sent her to an ophthalmologist over in Switzerland, over in Geneva, and the eye doctor, the ophthalmologist, said, no big deal. She sent me the OCT, and I looked at it and I said, you have moderate to severe neurodegeneration. I don't care what your eye doctor is telling you, but you have moderate to severe neurodegeneration. And then we tested her further, and she's actually working with one of my mentors, Judith McCloskey, over in Switzerland, because she needs some more direct care. So, Justin, if in my opinion, looking at each stage of the continuum is equally as important, because pathology in someone healthy may not happen yet. It's really the determinants of health first, then the blood lab. So I think if I was working with a healthy person who was really trying to optimize their health or to make sure they weren't heading down the path, I would opt, from an objective perspective, doing the blood labs, doing what I call your chronic disease temperature, because we're looking at your labs like this, not like this. And then the pathology tends to follow.
I see.
But I'm agnostic. I mean, if someone thinks they're healthy, I have so many people come in and they've changed their life. Now, when I do a risk assessment, their risk assessment's amazing. I grade you A through F, right? And they come in at a B or an A or something like that. But they change their lifestyle risk factors recently because of something that went wrong. And now they've made changes and they still don't feel well.
Yeah.
Those are the ones you can use the eye test and the blood lab test to see what's really going on underneath, because sometimes you can change those determinants of health, but when something takes over virulently but sneakily, I call them like hobos inside your body, then we have to identify those and help you get rid of those.
Yeah, that's good point. What are your thoughts? How does this sort of differ from iridology? What's the connection to that, if there is any?
So I've been threatened by many people to be introduced to iridologists, and I cannot cast any dispersions on what they're doing.
Okay.
But I haven't really studied it well enough to know exactly what it is. But it's almost like meridians. I have someone who's treating their meridians in their feet with shockwave therapy to work on treating their glaucoma condition. And it's very clear these meridians exist. So I can't really honestly tell you the connection between iridology and what we're doing. But what we're doing is bona fide recognized changes in pathology, seeing aneurysms in microvessels, seeing unfolded, misfolded protein responses, seeing cupping and deformation of neurological tissue in the back of the eye. Those are the kinds of things that we're looking at.
Interesting.
I won't cast aspersions in iridology, but trying to work with people that are more inclined towards traditional medicine, and then I go to iridology might be too much of a leap for them in terms of maintaining credibility. But at some point, I'm sure in the future, I will look at this from a real scientific perspective and make a judgment on it, but I haven't had a chance to do that yet.
Yeah, that's a good explanation, because at some point you're right. I mean, if you're going to be respected in your niche, not that iridologists shouldn't be respected, but it's a completely different discipline. Okay, we got another question here about the chat room. All right, so Dr. Lewis's take on infrared UVA, UVB exposure for your eyes. She does all during the appropriate times of the day. And I have a feeling that what she's talking about is a little bit of the Dr. Cruz kind of sun gazing type of thing, where you're getting early morning UVA, UVB, and UVC light indirectly into the eyes. What are your thoughts about that?
Well, the first thing is I never wear sunglasses.
Yeah,
I only wear blue blockers in front of these blue screens because it's a chunk of the spectrum, not the whole spectrum, and I believe like whole food, whole light is what we're designed to have. And it's almost a 1-year anniversary to when I was asked to present on Alzheimer's and infection with another 24 researchers in Switzerland, and we were at Kranz, Montana, and my wife and I went up on the chairlift to the top of the mountain, walked around. It happened to be where old sanatoriums were. And, you're exposed to much more intense light, including infrared light up there. And this was used to cure a lot of neurological conditions, a lot of mood-related conditions. So, I just think that we were naturally supposed to be getting natural sunlight much more frequently. I remember I went out, used to be a very serious cyclist. Now I've taken it back up at my tender-old age, and I was riding with a group. One of the young ladies in the group says, "You're not wearing glasses? You're not wearing?" I said, "No, I want the sunlight to hit my eyes."
Yeah, right.
You squint and dilate your pupils. That's my sunglasses. Thank you very much.
There you go. That's it, right? That makes sense, doesn't it?
Yeah. So I mean, whether I think Marvin Berman at Quiet Mind Foundation is a good friend of mine. Talk about photobiomodulation, neurofeedback, and photobiomodulation, the infrared helmets, and all that. Yeah, I think I think we're trying to make up for a paucity of good light exposure. I have people that work outdoors, but they're covered up, and they say they get enough vitamin D, and then their blood vitamin D is 25 nanograms per milliliter. You're obviously not exposing your skin the way it was intended to be exposed to, even if you're out, 4 hours a day.
Right.
So we are definitely not getting enough sun. No question about it.
Mm-hmm. Yeah, I agree. I totally agree. So, Doc, if people want to work with you, what would they do? Contact you at one of your websites and try to figure out the best course of action from there?
I think the best way to go, and whether you have an eye disease or a serious disease, is for, for your audience, if you went to healthrevivalpartners.com.
Okay, I'll bring that up.
And you showed that website earlier, went under services for $85, and I give you a 15% discount if you just put in HRP, the initials for our company.
Oh, cool.
That one right there.
Oh, good.
Chronic disease survey and assessment.
Okay.
Right there. And so it'll cost you like $70, and I'll spend an hour with you.
Oh my gosh.
To really see where you're at. Okay. And if you want me to look at your labs, you want to talk about getting an eye test and getting assessed there by someone who really knows what they're doing in terms of eye assessment. I mean, what easier, cheaper tool? So what I've done, Justin, is I have 120, 130 questions. It's not overly long. It's not short either. It's detailed. Mm-hmm. And every question answer, I give a risk score to. And we back titrated or forward titrated to the labs. And I'm showing that I give you a grade based on your numeric overall score from this risk assessment. And I link it to the labs that I've created a single score for. And they correlate very well. So usually I can predict what your blood will look like. But I'm happy to look at people's blood. Mm-hmm. I'm not going to do a diagnosis. I'm going to give you a risk assessment. And I'm going to give you solutions to overcome that risk assessment. If you want to work with one of my functional doctors, I have several that'd be happy to work with you. If you want to work with one of my health coaches, very happy to work with you. If you want to be referred into my optometry network, I don't have them all over the country, but there are broader networks like Vision Source and All Docs OD, groups like that are very skilled. And I give you a form to take to the eye doctor and have the eye doctor fill that out and then fax it to me. I can read their interpretation, and then my team can make an interpretation as well. So you're not stuck, you're getting a second opinion, because a lot of eye docs might be afraid to sort of like make that leap as to what a cataract really is. Mm-hmm. Yeah. I challenge you to go on Google or Scholar Google and type in AREDS number 13, AREDS number 13, and see the profound relationship between mortality and cataracts. These are things we don't take lightly.
So let me do that while you're AREDS, you said?
AREDS number 13. So you probably want to go to scholar.google.com or PubMed and do that. And, I have many lectures on eye and systemic disease, and there are at least 15 studies: Rotterdam, Beaver Dam, Blue Mountain. So if you clicked on the button on the right there on the NIH.gov, but what you're going to see
interesting,
is if you go in and, association of mortality with ocular disorders, and there's a great chart down there that shows the increase in mortality with different stages of visual opacity and macular degeneration.
Oh my
You may not be able to see it here, but you can click on it and pull up that figure. Jeez. And it shows the tremendous increase in mortality. So it's not a table, it's actually a figure.
Oh, I see. Okay. Oh yeah, right here.
There it
is.
Yeah. So you can see there, the bottom line on the left-hand side is increase in mortality. And then on the right-hand side, the x-axis is years.
Okay.
So you can see that, just having macular degeneration, cataract surgery, or a change in vision significantly increases mortality risk.
Jeez.
Okay, this is the flagship, and no one's doing anything about it. There have been 15 more studies globally. 15 more studies globally corroborating the same piece of data. That cataract and macular disease is actually a deadly biomarker. It's a biomarker for a deadly condition called cardiovascular disease.
Interesting. Now, why, Doc, do you think they're not doing anything about this in the mainstream? Do you think there's not enough money in it, or?
We live in silos, We've been siloed. And I'll tell you, Dr. Tremp, the last few years he practiced, he was fortunate to have a retinal specialty position at the New England College of Optometry, and his rent was free. but he was doing proper eye care and systemic diagnosis. And he was making 40 grand a year. Now, an ophthalmologist in Boston makes $600,000 to $1 million a year doing eye injections, which, by the way, harm you because they stop new vessel growth called anti-VEGF. And so you die of a heart attack, but you got an injection in the eye. There's no connection between the two, right? Oh, well, the reason why you have angina and don't die is because you form new vessels called collaterals.
Mm-hmm.
What they're doing in the back of the eye is they're injecting things that stop growing collaterals.
Wow.
And then this laser surgery and things of that nature that really don't solve the underlying problem. You know, the only good doctors, Chinese medicine, is the one that use food as medicine and all the things that those colloquial expressions that are totally true.
Mm-hmm.
But guess what it takes to help people reverse these conditions? It takes time. I can inject in 2 minutes and make several $100s an eye. How long does it take me to convince you that you have a systemic condition related to your eye and back titrate to that and work through the process of improving your health and lowering your risk for future morbidity and mortality? That's a conundrum. I mean, it's all about mana. It's all about the money.
Mm-hmm. People just want quick solutions, a quick thing, and that's it, right?
Well, yeah, and it's pharmaceutical driven. You know, there's only 6 companies that can bring any new technology to healthcare, and they have to invest $3 to $5 billion, so they have to recover that money to make it profitable. And you know,
That's
I mean,
crazy.
My health coaches will outperform any traditional MD because the traditional MD, pardon my French, ain't doing anything.
Mm-hmm. Yeah, I hear you. And what's cool about what you're doing, and I think this is going to be, the future of education as well as the future of healthcare is, I mean, you're going to spend for that introductory price, and we have no financial ties here, anybody, just so you know, but you know, $85, and I don't know, God only knows what you would spend on a doctor who on average spends between 7 and 12 minutes per patient. You're going to spend an hour with someone and go over their labs and their blood and all this stuff. I mean, when was the last time a traditional doctor's office, you go in there and spend an hour with a doctor? I mean, it never happens, right?
You know, and I believe that if someone took my labs, which are more expensive, but if, you know, they're way less expensive than retail, and you went through an hour discussion with me or one of my team members, really articulated, understanding what these mean from a chronic perspective, but more importantly, not what an individual number is telling you, but what the constellations of the numbers are telling you in terms of the story of your health. You know, you're not a number, you're a story. It's everybody you've interacted with, friends, family, that's the story of you. You're not just a number.
Mm-hmm.
And, you know, in my corporate program where I hate to call it wellness, but it's a corporate disease prevention and reversal program, is in order to get people moving away from the traditional philosophy of medicine, we do the labs and we spend an hour conversing with them about the labs and explaining the story of their health. And the reason why we do that up front is to convince them that we actually know what we're talking about, and it's very different than what they've heard before. You know, people say we do it differently, but what we do up front is really have a very profoundly different conversation stemming from the labs, and then we branch out in 2 directions, the eye one way and the risk factors the other way. But actually, I prefer to start with the risk factors and then lead people into labs. It's a much more cost-effective introduction. And a lot of times people have labs that they've obtained, but just no one's really interpreted them properly from a chronic perspective. And I'm very happy to, you know, include that in an initial consult.
That's really cool. All right, Doc, one final question from the chat room, and we're doing this. Sure. Let's see. This is from Sarah, and Sarah typed it in all caps. Cool. Thanks, Sarah. I appreciate that. But this will be the last question. So she wants to know about B12 shots, and she says, basically, how healthy are B12 shots? Do you have any thoughts about that?
Very interesting. I just had a participant and colleague ask me about B12 this morning. Number one, you know, you want to make sure it's methylcobalamin, not cyanocobalamin. Okay. Number two, you know, the dose makes the poison. What are you trying to achieve? And what I've seen, I call it reductionism. our body's a symphony. If the trombone is just playing their notes, what the heck are they playing? You don't even realize it's part of a beautiful symphony. And so just taking B12 in isolation from everything else may not be providing the overall result. So for example, beta carotene, Justin, we talked about vitamin A. When you give just beta carotene, smokers actually get more lung cancer than less, because vitamin A is a mixture. Okay. So the B vitamins work together. Fortunately, most B vitamins are water soluble and you pee out what you don't need.
Mm-hmm.
But the dose makes the poison, and I'm kind of against very high doses. I mean, we give some folks a multivitamin with a balance of B vitamins, but I try not to go 83,000% over the RDA. I mean, there's been association to brain fog, lowering homocysteine, but the B12 is not some miracle mono thing that all of a sudden creates enormously balanced health within our bodies.
Mm-hmm. Good stuff.
Not opposed to it.
Yeah. I mean, everything in context, right? Everything in context.
Right. Everything in context.
Yeah. So, Doc, if people want to find out more about you, let me bring up your website so people can take a look if they're watching on YouTube. And it's realhealthpartners.com, right? And I'll bring that up.
Health Revival Partners. Yep.
Oh, I'm sorry. Yeah. healthrevivalpartners.com and Real Health Clinics. That's why I messed up there. Yeah.
Yep. And if anybody emails me or contacts me, I'll send them a link to download some of our books and writings.
That is cool.
We've written 3 books. We have a number of publications in peer-reviewed journals, and a whole host of other things. So, yeah, that's
great.
This is the website where we silo eye and brain together. Keep it simple. Don't try to be too provocative to say, hey, it's really the whole milieu, right?
Uh-huh.
But most of us know it's the whole milieu. And yeah, if you watch any of these videos here, they're pretty much, that's a short one there on the eye and systemic disease that I presented with Jordan Rubin and Ty Bollinger were at that conference presenting as well.
Okay.
So
that's great.
Yeah.
So that's
friend Thomas Watkins, the biological guru dentist in Franklin, Tennessee.
Nice. A lot of cool stuff. So I like what you're doing, piecing all this stuff together and trying to figure out what the heck this whole thing we call health is. And, it's a lot of times most people are not putting it together, especially medical doctors, and they're kind of running around ragged trying to go from one medical doctor to the next, and they're just not getting any answers. So, Doc, I really appreciate your time today and sharing your expertise with us. Yeah, really great. Thank you for being on today.
Thank you so much. Yeah, I really appreciate the time on the air, and I hope your listeners got something useful out of it.
Awesome. Cool, Doc. All right. Well, I will be in contact with you via email, so I'll send you the links and all that stuff afterwards. Thanks so much, Doc.
All right. Take good care. Bye now.
Okay. Bye-bye. All right, guys. There you go. Dr. Thomas Lewis. I hope you guys enjoyed that show. I've got a couple things I'd like to share, and I'm curious what you guys think. So maybe we'll just sort of chat it up a little bit in the chat room for just a couple minutes. I'm here for a little bit, and so I wanted to run this, and I'll be right back right after this short little break, and I want to see what you guys have to say about this.
This is Extreme Health Radio, where we're 100% listener supported. Make sure to join the Extreme Health Academy with thousands of other listeners and get real solutions for your health challenges.
Yeah, guys, we have so many people in the Academy, so many amazing listeners, and we're adding courses every month. We're doing live Q&A. We're doing all kinds of really, really cool and interesting things inside the Extreme Health Academy. Specifically, what's cool is that we are in the forums. I'm in there just about every single day answering questions and helping people, and it's just a lot of fun. So if you guys want to join us inside the Academy and get access to over, I think, 140 hours of content, 18 courses, all kinds of stuff from bones to sexuality, to eye health, to skin health, to cancer, all kinds of cool stuff in there. So frankly, this is all stuff that should have been taught in school. So let me give you a free 14-day trial. So if you go to extremehealthacademy.com and then enter the code EHR14. You'll get a free 14-day trial. And make sure to come over to the forums and tag me so that we can hang out and talk and all that good stuff. So it's just a logical progression of our radio show where we can actually dig deep and talk about solutions and share things in a way that, frankly, we can't really talk about in public. So it's for a lot of reasons. So come and join us over there, and I'd love to connect with you further. And one of the things I want to tell you guys about is, I don't know if you guys have you tried the Stockton Aloe One that's available on our biochargeme.com store? If you're looking to improve your digestion, this aloe vera is incredible. Aloe vera has been used for centuries. It's antifungal, it's antibacterial, it's antimicrobial. It helps sterilize the gut. It's incredible for soothing your digestive tract, and it's so cooling. And I think it's something that people should be on a daily basis. And I love the stuff. And here's what Dr. Donnie Wilson had to say about aloe vera in particular.
And then I encourage, we can talk more about this. What do I do to help people speed up the healing of leaky gut?
Mm-hmm.
I mean, you mentioned aloe before,
Mm-hmm.
and that is one of the herbs that I definitely recommend, using for helping to heal leaky gut. You want to use herbs that are anti-inflammatory and soothing and healing to the intestinal lining. So aloe is a great one.
Aloe should be consumed by everybody on an ongoing basis. It's what they call in Chinese medicine a tonic, even though it's not a Chinese sort of product. But this stuff, it comes to you frozen. And what they do is they send it to you flash frozen. And this stuff it's great. If you go to your store and look up aloe vera, or you go there and you look at all the other excipients and other chemicals and ingredients they have, it's degrading the product immensely. And what this is pure 100% aloe vera, uncooked, unheated, unprocessed, untampered with. They cut it and then they blend it up and then they put it in a bottle, freeze it, and send it to you. So this is really, really good stuff. And if you're looking to improve your digestion, look at this. There's nothing more soothing than aloe vera. And it's just, what a product this is. And I'm super just honored to have it in our store. And I don't talk about it enough. So look into getting some of this Stockton Aloe One that's available on the biochargeme.com store. And here's something else that I wanted to tell you guys about too, and it's something I'm really want to stress the importance of mitigating our EMF exposure. And this is Dr. Garrett Smith, who I mentioned on the show today, but this is his work with vitamin A, but also with regards to non-native EMF. So check this out.
I do have another paper on low frequency electromagnetic fields when combined with retinoic acid caused more tumor type changes in cells in vitro. So we have seen people who do this kind of avoiding vitamin A and the detox program that I do, who become much less electromagnetically sensitive. I used to be electromagnetically sensitive. I'm not.
Really?
I still don't think it's a good thing, but I'm not. I used to hardly sleep at all from EMF stuff. And now I don't really have that problem anymore.
Yeah. So what's interesting is that this dirty electricity that you have probably in your walls, and every home is going to have it unless the home was constructed with intention in mind and from an accurate and a building biologist who knows what they're doing. They're going to have what they call magnetic waves coming off of the wires as well as electrical waves, because these wires aren't protected properly. And when Brian Hoyer came to our house, we had so much radiation coming just from our walls. And here's the scary thing. It's not scary, but it's just interesting, and it's something that we have to take into account in our ever-changing environment, is that they're now saying that 5G is jumping on to the dirty electricity that's in our walls. So dirty electricity, according to Magda Havas, is responsible for altering blood sugar levels, for breaking down the cellular membranes, according to Martin Pall, allowing calcification to enter the cell. Up to 1,000 times more calcium gets into the center of the cell instead of being in the blood serum where it belongs. And according to Martin Pall, we're going to have him on the show at some point, but he maps out and cross-links like 100 different diseases specifically to this influx of calcium going in places where it doesn't belong. And so what's happening is that this electricity that we're exposed to is breaking down the voltage-gated calcium ion channels of our cells, allowing that interstitial calcium to flood in. Now, I don't know how it all works, but I can tell you that if you look back at the invention of electricity, and if you look back at the invention of non-native EMF in the form of electricity and light back in 1879 to now, and you map the disease rates of diseases, it's like it just goes up progressively. They both go up and rise in the same way. And is it possible that, like what Dr. Jerry Tennant said, healing is voltage? So this dirty electricity that's in the walls, this Wi-Fi that we're exposed to, portable deck phones in our home, 5G, ambient radiation coming from everywhere, is this altering the voltage, the cellular voltage of our bodies, causing them to break down? And I believe that it is. And one of the ways you can mitigate this is through these Greenwave dirty electricity filters. So you can get actually a meter, and you can check the meter before and after your wall, and you can see it dramatically reduced, like almost by 98% reduction. And this dirty electricity coming out of your wall. So if you have a kid, if you have a child, if they're having trouble sleeping, if you want to get one for your bedroom, these are affordable, and they're starting at like $30. You can put one or two of them in your bedroom and sleep better. And I just can't recommend these highly enough. So if you guys are interested in these things, check out biocharge.me. If you're listening on a podcast, I'll put links to them at extremehealthradio.com. What episode number is this? Where are we at? I think this is 631, extremehealthradio.com/631. If you're watching on YouTube, there'll be links in our bio or down below if you guys want to check those out. So the Greenwave dirty electricity filters, the Stockton Aloe One, the Joovv red light therapy, and one of my favorite things is the relaxed far infrared sauna. So I'm just a big fan of bringing these into your home and making sure that you're turning your home into a healing place. And I think that's really, really important to do. So it's really cool. I'm glad to be able to offer these products that we use and we believe in to you guys. And it's all stuff that I'm stand behind, and that's why we put them in our store. So if you're looking for ways to support us and get some good products and things like that, check out biocharge.me. And what do you guys think? All right, so I'm going to go and hang out for a couple of minutes in the chat room and see what you guys think about all this stuff. And if you guys want to call up Extreme Health Radio on Skype, and it may work, it may not, so we can always use you as a guinea pig. But Fatima says, anyone know a really good doctor in Tennessee? I've had a bad case of RA. I've tried to research for months, but there's very few. I prefer physical visits than online. Ooh, Fatima, I don't know. If you are listening to this and you know of any good doctors in Tennessee that you can help Fatima with RA, that would be great. There's lots of resources online, but if you want to see someone in person, I, for one, don't know of anybody in Tennessee. So let's see. Great subject. Thank you for a perfect show. This world is crazy. I like your handle. This world is crazy. Yeah. So, what's interesting, guys, is do you guys ever notice that, you have friends, family, maybe moms or dads or, older generation, older folks, running around to different doctors and trying to figure out what's really going on. And I see it all the time. And, it's unfortunate, but medical doctors just do not know. They just don't know what's going on. They're not spending the time to do any research. And I get it because, their lives are busy. But my goodness, it's such a challenge. So I just want to encourage you, if you're looking for a solution, an answer to your health problems, just keep looking, because that's part of the magic of this whole thing. Because, it's my contention that either we work with God or we had a soul contract before coming into this life, that in some weird, bizarre way that we don't fully understand as humans, we come into this life knowing what the challenges we're going to have are going to be. And the reason why we do that is so that we can learn and grow spiritually. And it's sort of like with the ancient Chinese would say, whenever they were coming across herbs, that they were looking for specific herbs for specific health issues. And they would always say that the person who had to search the longest and to travel the farthest distance, they would be healed, because they are the ones that are actively looking and searching and sharing with God and sharing and making a public declaration that I'm willing to go out and seek out what my disease is and how to overcome it. And for those people, the herbs work the most. And so, and it makes sense too that, the only reason why we're here, in my opinion, is that we're here to grow physically and spiritually and emotionally. And the only way to grow like that is to have some kind of physical ailment, because if we don't have any problems with our body, then life is easy, life is simple. There's nothing to resist you, right? So you just have a nice, calm, easy life, and there's no growth in that. The only growth happens is when we actually come up against resistance. And the only way that can happen is through something happening to our physical body. And that's how we grow. And I've been through so much, and I know you guys have, listening, and it's, it's an invitation for us to go deeper. And I think that's really what it's all about. So I hope you guys enjoyed that show. And, that's part of what we do, is just bring options to people. Let's see. Odette's Days says, I nebulized Sovereign Silver for my son for a cough that he had for a week. After a few treatments, he was done with the cough that had been persistent all day and night. Yeah, that's a good thing to do, guys. So if you guys are, most of you are listening in the Northern Hemisphere, where we're moving into winter and fall and what they call the flu season. And I would encourage you to get a nebulizer. And we have, I think, a couple in our store. We like the Omron, and there's another one where you can actually make your own silver. We have those at biochargeme.com. But you can go on there and get a nebulizer, and what you can do is you can get really fancy with these things. And what's cool about nebulizers is that it's kind of like a rebellious act in a way, because nebulizers were originally designed and created for as another method of the pharmaceutical industry to be able to get their medical poisons into people's bodies. So the idea behind a nebulizer is to put pharmaceutical meds in there so that you can inhale them into your lungs. And it is through our lungs that we can ingest medicine, and it's a tremendous way to get medicine into the bodies through the lungs. So it's kind of like a little rebellious act. You kind of hijack a nebulizer and put good things in there. And so some of the things you can do are, some people have done. Now, I'm not saying you should do this, or it's a good idea to do this, but here's some things that I've heard of people doing. What I used to do is I used to crack a little couple cloves of garlic. And in the Omron nebulizer, which is really great because it's like a portable one that runs on batteries. And what's cool about the Omron is that you can take it on a plane, and it's super quiet too. So it's great to travel with. So what I used to do if I was coming down with a cold or something, a cough like that, is crack a couple cloves of garlic and put 3 or 4 drops of fresh garlic juice, and then put the rest silver. And so we have a silver that we have in our store as well. And so I'd fill up the reservoir with that, with garlic and silver, and breathe that. And talk about just a carpet bomb. And it was just tremendous for helping my lungs recover. So that's really a cool thing to do. Fatima, thank you for reading my comment, and this podcast helps a lot. Yeah, you're so welcome. Learned a lot, Danielle says. I hope so. Yeah, that's part of what we're trying to do, is spread education and give you guys options. And so, if you're going to the doctor with a cough or something, try a nebulizer. And I recommend these things because, you can get a nebulizer for relatively cheap. I think the Omron that we have that's on our store is like $130 or something. And then we have options for making your own silver in our store, along with buying silver. And both of those are available. And you can just buy some silver, buy some garlic, or just do the silver. And now you have yourself a really great remedy to use, in case something ever happens with your kids or whatever. And you can just, keep this thing in your, in your pantry or whatever. And, it's interesting too, because we had David Milburn on a couple episodes ago. We had him in studio, and that was a really good episode. We talked about air quality, and I really recommend starting with parts of your house that are going to move the needle the most with your health. And what he mentioned on that show, which I thought was really interesting, is that we breathe the equivalent of an Olympic-sized swimming pool of air every single day. Now, according to Barbara Frank, who we had on a couple days ago about parasites, she says parasites are now airborne. And you talked to David Milburn, and he was talking about all kinds of chemicals coming from tire dust, chemtrails, and Stephanie Seneff was talking about recently that on our show that glyphosate is now airborne as well because, fuel is 10% ethanol coming from genetically modified corn, which is sprayed with glyphosate. So now she's thinking that we're breathing this stuff in. And so what's crazy is that you're breathing an Olympic-sized swimming pool worth of air every day that's going through your lungs. And, so if you don't have a filter, you become the filter, right? So that's why it's really important to make sure that we're optimizing our lung health and optimizing our breathing and our internal air environment. And that's why it's really important, I think, to start there. So anyway, that's a little bit off topic, but I hope you guys enjoyed that show. Big Fat Mama, busy at work, had to pays. I'm 20 minutes behind live, so thanks for the show in advance. Yeah, no worries. That's cool. Yeah, so I hope you guys enjoyed it. Alma, Jeanette, Odette Stays, Fatima, Danielle, Big Fat Mama. You guys are awesome. So thanks for joining us. Twilight was in here a lot. Whoop, whoop. Whoop, whoop. Angie, so many cool people in the chat room, and I love connecting with you guys. So I really appreciate it. So just to give you a little update on what we have coming up. So today was Dr. Thomas Lewis, episode 631. Then on Friday, so this is going to be an interesting show, Dr. Stephen Baker, Project 180. And I was trying to figure out who he was and so I looked more into his work, and we're going to be talking about autism and vaccines. So that's going to be really cool. Next week, we have 3 shows for you. So this will be fun. We have Morley Robbins, and he's going to be doing a workshop for our academy going super in depth with his root cause protocol. So that's going to be, if you're a member of the academy, that's coming up. And that's going to be a live event inside the academy. So, that is going to be really cool. So he talks about iron, copper, and magnesium, and calcium, and how these minerals need to be regulated. And if you follow us on Instagram, you saw me the other day donating blood to lower my iron levels. So, so that's going to be a cool show. That's next Monday. That'll be a free show for you guys on Extreme Health Radio. And then on Wednesday next week, our doctor, who we were going to have a home birth with, Dr. Stuart Fishbein, he's going to be in studio. So that's going to be a live show. It's going to be super fun. He is a medical doctor, but he's the only medical doctor that is allowed to assist mothers to give birth to twins at home in California. So he is an extraordinary guy. And, usually we're a little bit not a big fan of medical doctors, as you can imagine, but he is awesome and just love supporting him. So that's going to be a fun show. I think Kate's going to be on that one too. So that'll be a lot of fun. And then next Friday, we have William Hang, DDS, Extraction, Retraction, Regret Syndrome, Reversing the Suffering and Preventing the Occurrence. Wow, that's going to be cool. So lots going on here, guys. If you want to support our work, you can always go to biocharge.me. You can sign up to the Academy. That would be the best way because that way you get access to all of our in-depth premium content and you get access to a really awesome community. And I'm in there a lot in the forums just about every single day. And so that's a lot of fun to be a part of the Extreme Health Academy. Or a lot of people are now donating to us on Patreon. So there's a link for that down below if you guys are watching this video, or on our website, extremehealthradio.com. But many of you guys just like the free content, and that's cool. So Alma says, where do you get the blue blockers? So these blue blockers I have, they're from biocharge.me. And if you go to the light section, they are there. And we promote 3 companies, and we use all 3 and really like them a lot. They are, the ones I have on now are from a company called Blue Blocks. The ones that I wear in the evening are from Raw Optics. And then I also wear the ones in the evening and daytime from True Dark. And so those are all available on biocharge.me. And so I highly recommend. We're good friends with Andy and the work that he does over there. So like supporting him and just good people doing good work and all of that. So thank you again, everyone. I really appreciate it. I'll put everything available that we did on today's show at extremehealthradio.com/631. And all the links will be there. This should be up a little bit later tonight, hopefully, if I can get my act together and produce the show. And love you guys a lot. I just feel really honored and privileged to be doing this kind of work. And it's just, I don't know. I just feel like a calling to do it, and I just feel like it's helping people. And, I'm really just feel like my sort of role in the world is to bring options to the table for everybody. And I don't know. It's just something I feel called to do. And hopefully in some way our work is helping you guys. So that's why we're doing what we're doing. And so, when you support us on Biocharge Me, or going through our Amazon link, or Patreon, or joining the Academy, when you support us in those ways, it helps us continue to do this work. So just honored to be here with you, and all that good stuff. So if you're working wherever you're doing it today, I hope you're enjoying your day. Love you so much. We'll be back on Friday with whoever I mentioned before. I don't even remember. Oh, Dr. Stephen Baker, vaccines, autism. So that's going to be fun. Again, you guys are amazing. Thank you so much. And share this show. Follow us on Instagram if you guys want to stay up to date with everything we have going on. Love you all so much, and I'll catch you guys on Friday at 10:45 Pacific. Until then, have a great week, and I'll see you on Instagram.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog, or to start any health program without first consulting a health professional. The content found here is for informational purposes only, and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse of this information.